Hi, I'm Ruksheen Minotra Homji. I'm one of the PGY1s with the Department of Family Medicine, and I'm currently posted at Byron Family Medical Centre, which is my base center. I work with Dr. Sejik's team, and we started here in July of this year. It's been a wonderful experience. The thing that I like the most about the center is it's a very congenial environment to work in. Everyone's really very helpful. It's pretty much an open environment in which you're not pressured to ask questions, and you feel free to ask questions about your doubts and patients or anything to do with academics or otherwise. It's been an interesting start to me because I, as an IMG, we essentially begin with a certain period in which we're assessed, and I haven't felt pressured at all during that entire time. The learning has been excellent.
I'm a second-year resident, so this is my second time through the clinic here, but they're actually very accommodating. I came in technically as a PGY1, but I was a transfer student or resident from anesthesiology. Having done 2 years in anesthesiology, I transferred into family medicine, and already from my first week here, they were very accommodating of my perhaps a little bit different learning needs. Certain areas of my medical knowledge were a little bit dusty and needed touching up because I'd been focusing on anesthesia rather than family medicine. So they were actually very adaptable, or sorry, they were very accommodating of my specific learning needs. So far the experience has been fantastic. I mean, as I said, they always give us constant feedback about how we're doing, but they also ask for feedback as far as how they're doing as teachers. And this is both the nursing staff as well as the staff physicians. They always ask us if there's areas of learning that we're missing or we feel like we're not getting enough exposure to. So they're persistently or constantly looking for ways to improve our experience as residents and improve our training.
The patient population definitely, I think, belongs more to the middle to higher socioeconomic class. So that has a challenge. That is a challenge on its own with terms of patient education. And most of the patients are very well educated. They know a lot about their disease. They're very aware of their health. So I think that's one of the challenges that we do face as residents here, because we have a lot of patients coming in thinking that we have something, and then just going through that whole scenario with them is challenging. But very receptive patients most of the time, and that always makes your job easier. So I think that's excellent.
Most of the preceptors have some kind of niche. There's certain things, because it's an urban practice, there's certain areas that aren't covered. I know the rural practices do cover a little bit of emerge and some hospitalist work. There's not as much coverage in terms of that. However, there's certainly OB coverage. So Dr. Jordan, one of the staff here, covers a lot of OB, and we help out with the other family physicians who covers obstetrics. We also have a doctor here who specializes in chronic pain as well as palliative care. And some of the other preceptors do have subspecialties. One of them has decent training in sports medicine. So it certainly gives you a good variety of teachers to learn from. And so they all complement each other as well.
Hello, I'm Dr. Sunny Sejik. I'm the medical director here at the Byron Family Medical Centre. We're one of the 3 urban sites for the medical residency program. Our centre is located in the west of London, across from Springbank Park. It's a very nice park out there. As well as our teams arranged in, our centre is actually arranged in teams, so it's 4 teams, and each team has a nurse, 2 medical residents, and also at least 1 preceptor. We also have other learners, such as medical students, as well as other learners, nursing students. And we have a multidisciplinary team consisting of many interdisciplinary health professionals that we receive from the Thames Valley Family Health Team, and as well as clerical staff here. We're owned and operated by the London Health Sciences Centre, and we're also affiliated with the Schulich School of Medicine and Dentistry, as well as the Thames Valley Family Health Team. Our preceptors at the center have a lot of different interests, and some of them include obstetrics and palliative care, and also care of the elderly, and administration as well. We're big on that. We also take care of the residents at the Dearness Nursing Home that's actually operated by the City of London. So our resident doctors go out to that location as well for care. We strive to be excellent in patient care as well as research and education, so that for our residents, we certainly value to make sure that they have continuity of care with their patients, and also that they get the educational needs met at our center. As they stay with us for two 16-week rotations, and that's over the period of 2 years, we hope to provide them all the skills that's necessary to make sure they become excellent clinicians.